First, let's remember that the thyroid gland, which is a small butterfly-shaped gland in the front of our neck, makes a hormone called thyroid hormone that's essential for our general well-being, metabolism, controls virtually every organ system in the body. It can malfunction either to make too much thyroid hormone, we call that hyperthyroidism, but much more commonly, it can become underactive, and that's a condition called hypothyroidism. The level of thyroid hormone in our body decreases, and that eventually has effects on everything from our brain to our weight, our metabolism, and all other bodily functions. We certainly know it affects women more than men. About 80% of all thyroid conditions occur in women. We do not understand fully why that might be, but it's well established. We know particularly hypothyroidism tends to become more prominent as we get older, so that it's much more common in someone in their 50s, 60s, 70s than early in life. Hypothyroidism is due to a deficiency of thyroid hormone, also called thyroxine or T4. The benefit of the medication, thyroid hormone, both brand and generic, is thyroxine or T4. And the body needs a certain level of T4. If it's not coming from the thyroid gland, it can come from a little pill that you take every day. But the ultimate goal is to get the blood level of T4 back to normal. That will correct the TSH, it will become normal, and then all those other abnormalities in the body, the cholesterol levels, the heart rate, the fatigue, the control of energy metabolism, mental function, intestinal function, all of those others will return towards normal over the next couple of months once treatment's initiated. We were interested in looking at a common problem that has been discussed in the endocrine and medical literature for decades. The question is whether or not generic thyroxine, which is the most common thyroid hormone, whether or not generic thyroxine is equivalent to one of the branded forms of thyroxine in terms of improving blood levels and symptoms a patient might have. Given that there are a number of cardiovascular conditions that develop during the hypothyroid condition, we were interested in looking at available data comparing patients who were going on thyroid hormone for the first time, newly diagnosed, and who were either given a generic thyroid preparation or one of the multiple brand thyroid hormones, to see if over the ensuing period of time, once they started therapy, there was a difference in the development of new cardiovascular events of any kind. This study, we did not find any significant difference between patients who were put on generic levothyroxine or one of the branded forms. So what do the results mean to patients? The reassurance in the short term is that choosing either a brand or generic form of thyroxine seems to be equivalent in terms of risk of any new cardiovascular events with that therapy. Whether hypothyroid patients are taking a generic or a branded form of thyroid hormone, it is very important that they maintain contact with their physician and have a checkup on average once a year with a blood test to make sure they continue on that same or on the appropriate dose of thyroid medication. The study that we performed used a database of patients who were started on thyroid medication for the first time, and then we were provided information on all of their baseline health conditions and development of new health conditions over the time they took the medication. The total amount of follow-up available in some of these patients was up to 9 years. However, the average follow-up from the data that was available was only 1 year. So this was a short period of time. The strength of the study was it included patients from across the United States. It also had a very large number of patients. We started with over 200,000 patients who were started on thyroid hormone. The final study ended up with close to 44,000 patients in each of the two cohorts of patients we followed once these patients were balanced so that each group had the same number of people who had hypertension, which is a risk factor, the same number had diabetes, the same number had a prior history of a heart rhythm disturbance or a prior history of a stroke or heart attack. One of the areas we hope to study in the future is a large cohort of patients in which we also have follow-up lab testing once they go on treatment. To explain how the testing is monitored, we measure both the level of thyroid hormone in the blood and we measure a hormone from another gland called the pituitary gland. That hormone is called TSH. Those two hormones both can become abnormal in hypothyroidism, and they become abnormal in opposite directions. TSH levels become elevated, T4 levels go down. When you go on thyroid hormone, both of those should return to normal. And that's how your doctor determines if you're on the right amount of thyroid hormone. Since we didn't have access to follow-up lab data, we don't know if patients on generic and on branded thyroid hormone had the same normal levels going on those hormones. And that's very important data that needs to be obtained in a future study.